Yes, I'm Dr. John Graether. I'm an ophthalmic surgeon, retired. Um, well, I at first thought I was going to be interested in optometry. So I went away to the Pennsylvania State College of Optometry for a year. And I said, no, this is way too limited. I want a much broader approach to eye problems and eye disease. And so I went back to the University of Michigan as a junior student and had good grades in my junior year. And they accepted me in medical school after my junior year at Michigan. I graduated from medical school, I believe, in 1957. I was always interested in ophthalmology. First in optometry, as I mentioned, but then really I wanted a broader field, and so I really wanted to become an ophthalmologist. And I wanted to get the best training I could find. And I knew that the University of Iowa was consistently in the top 5 or 6 places to train. And so I chose to intern at the University of Iowa, which gave me a 1-month rotation through the department. And I was duly impressed with it because Alison Braley, who was head of the department at the time, had recognized that there were several scholars in Europe who had wonderful academic training, but were floundering to find a place to land in Europe because of all the chaos after the war. And so he obtained visas for them and brought them to his department. A brilliant move because these people were incredible. Mansur Arblay went on to do the glaucoma study in Des Moines, and there were others that were equally prestigious. And so that environment was extremely rich when I was going through as an intern. And so I asked Braley if I could obtain the residency. He said, yeah, not right away. I'll have to put you off in neurology for 6 months, but then come January, you can become a resident. And so that's the course that I pursued. And I was very satisfied with it. I thought my training there was really excellent. But we lived on 1440 Washington Heights, which was right near the campus. It was a little street, so I could walk to the campus. And it was ended overlooking a valley there were some sheep in an adjacent pasture, and you look down into this lake area. So it was quite a pretty location. Yeah. And they had some sheep next door, which amused my son, who was about 3. And so we enjoyed that experience. We were in a condo with another couple. He was in dentistry. We had grand rounds in the morning for about an hour and a half. Right there, we all operated out of one big room. Everybody just had desks in this room. Nobody had offices except the chief. He had an office. So there was a lot of interaction during the day. It was a rich milieu of activity because somebody would have an interesting page. They say, "Give a look at this," And so, and we had grand rounds of the morning where they presented patients formally from the day before usually. But during the day, you'd get interrupted to come over and view this or that, and it was really a very good way to learn. You learn almost by osmosis. And you had all these really high-quality people there that were immediately available to answer questions or give you input. I was particularly impressed with Paul Woder, who was in physiologic optics. And we became friends, actually. And when he would come back, I would always take him out to dinner because he was such an incredible raconteur. He was a wonderful storyteller and a fine gentleman with a a beautiful vocabulary. I just enjoyed knowing him. As a young man, he was a gymnast, and he could still stand and do a standing somersault. That's amazing, isn't it? Yeah, he was a relatively small person, but he was really agile. It was a nice apartment with people who were very willing to discuss things with you. They were all in the department. None of them had full-time practices. So they were all in the department all the time, which made it a very rich environment, as I mentioned. Yeah. And I was with 8 residents, as I mentioned, in my group, and there were, I think, 3 groups of 8, so that's 24 residents at a given time. One of the things that was very valuable was the emphasis on being thorough. Collect all the facts before you try to make decisions about something. And I think that applies to any activity, obviously, and there was a lot of emphasis on knowing where you were before you tried to do something. So I did a couple of corneal transplants while I was a resident. I did a lot of them after I was in practice because that was a time when the lens implant, putting an artificial lens in, was highly controversial because a lot of the means of putting in the lens were faulty. If you hang the lens on the iris or put it in the anterior chamber, you tend to produce inflammation. The lens belongs in the capsule of the natural lens, which you've removed. Of course, now that's standard of care. And our group there and other groups, leading groups around the country, developed that approach, and it proved to be the right way to approach a patient with a cataract. Memorable cases. Well, there certainly were several of them. One, of course, is the fact that the sitting governor of Iowa, Robert D. Ray, said, I would like to have a lens implant. His optometrist said, Bob, I've sent at least 100 patients to John Graether, and they're all doing well. I think you ought to talk to Dr. Graether. They called me the day before the surgery. I operated on the day after Thanksgiving, and they called me on the day before Thanksgiving and said, this information has gotten leaked out. Would you mind if we had a press conference after the surgery? I said, no, if it's okay with Bob, it's all right with me. And so I was astounded when I went down to the boardroom of the hospital and saw these 2 network cameras set up and so on. I implanted a lens in the sitting governor in 1981, and I got a very nice letter in reply from the governor thanking me for restoring his vision. And that publicity that went with that helped to legitimatize the operation. I did invent a couple of things. I was the first one to publish the circular capsulotomy, where you tore the capsule in a circle to make an intact circle so that you could slip the lens in within that capsule remnant, and it would be stable and well-centered. That was, I think, an important contribution. And I did invent a instrument called the Graether collar button iris retractor. And that instrument, which had a narrow neck and smooth contours, was copied and developed into a myriad of instruments, probably 8 or 10, that took my basic idea of the narrow-necked instrument with smooth surfaces and made various modifications of it. Like the Lester hook was a good development from that. And he acknowledge that it was my idea that he modified, and others did the same thing. So I think those are the two things that I contributed